Hello and welcome to Chapter 12, Airway Management. This is going to be the first section in Chapter 12, titled Introduction to Airway Management. As always, this is Keith Widmeyer, here with Wayne County EMS. Alright, let's get started. All living cells of the body require oxygen and produce carbon dioxide. Oxygen is particularly important to cells of the nervous system because without it, brain cells begin to die within 4 to 6 minutes. The most stressful and chaotic scene usually involves a difficult airway. A non-breathing patient or a patient with difficulty breathing is a true emergency. To prevent death, you must be able to recognize early signs of breathing difficulty and know what to do. Everything starts with the ABCs, airway, breathing, and circulation. If you cannot control those three things, your patient will not make it. Start out with the respiratory system. Major functions of the respiratory system are to deliver blood-rich oxygen from the atmosphere to body cells and transport carbon dioxide produced by body cells to the atmosphere. As an EMT, you must make sure these functions happen by maintaining an open airway. Maintaining an open airway allows for a free flow of air into and out of the lungs. When we breathe in, the air entering the body from the atmosphere is rich in oxygen and contains little carbon dioxide. Carbon dioxide is a waste product produced from breathing. The oxygen-rich air enters the alveoli in the lungs and passes through the walls of the capillaries into the bloodstream. Carbon dioxide passes from the blood through the capillary walls into the alveoli, leaving the body in the air we breathe out. It's important to remember when we take in a respiration, the atmospheric oxygen is 21%. When we exhale, when we're exhaling all that carbon dioxide, we're also exhaling 17% oxygen. The nose humidifies and filters the air before it enters the lungs. A wall of tissue called the septum, separates the right and left nostrils. I want you to know the term nares, N-A-R-I-S, nares. The nose is lined with mucous membranes that are fragile. When the nose is subjected to trauma, it is prone to bleeding and becomes inflamed, which can cause an airway obstruction in itself. The bleeding or the inflammation can block off the passages, and the bleeding can cause obstructions within. The nasal cavity is separated from the cranium by a thin bone, which can become fractured as a result of head trauma. The mouth, also called the oral cavity, is formed by the cheeks, lips, hard palate, and soft palate. Air enters the body through the mouth or nose and passes down the pharynx, throat, past the epiglottis, down the trachea, and into the lungs. Air entering the mouth is not filtered or warmed as efficiently as air entering through the nostrils because of everything we have up in the nose. Everything from the nose hairs, which help clear debris, the moisture. The pharynx is a funnel-shaped muscular tube that serves as a passageway for food, liquids, and air. The uppermost part of the pharynx, the nasopharynx, is located directly behind the nasal cavity and serves as a passageway for air only. The oropharynx opens into the mouth and serves as a passageway for both food and air. It is separated from the nasopharynx by the soft palate. The lowermost part of the throat, the laryngopharynx, surrounds the openings of the esophagus and larynx. It opens in the front into the larynx and in the back into the esophagus. It serves as a passageway for both food and air. The larynx contains the vocal cords. This area is the narrowest part of the adult airway. The vocal cords are responsible for sound production. The space between the vocal cords is called the glottis. The largest cartilage of the larynx is the thyroid cartilage, also called the Adam's apple. The cricoid cartilage is the most inferior, the lowest of the cartilage of the larynx. The narrowest part of the child's airway is the level of the cricoid cartilage. The epiglottis is a piece of cartilage that protects the lower airway from aspiration. When we swallow, the epiglottis helps in closing the glottic opening, preventing food and liquid from entering the trachea. Choking may result if the epiglottis fails to close. If you look at pictures in your textbook, the epiglottis looks like a big leaf, and as it says, it's what covers the trachea and prevents food, drinks, and other debris from entering. The upper airway is the most common place for an airway obstruction to occur. When the patient becomes unresponsive, the tongue falls back into the posterior oropharynx, which is where? Exactly, the back of the mouth. This can cause a complete airway obstruction. Other common causes of upper airway obstructions are dislodged teeth or dentures, blood, body secretions, and foreign objects. I'm trying to think. Something else that's not listed here is vomit. Vomit is a major airway obstruction. An airway obstruction at or below the vocal cords will affect the ability to produce sound. You may be able to recognize signs of an airway obstruction and act quickly to remove the object in order for the patient to survive. The lower airway, we start out, the trachea is protected and supported by C-shaped rings of cartilage called tracheal rings. This allows for some expansion during breathing and coughing. At about the point of the mid-sternum, the trachea divides into two main branches. One branch, the right mainstem bronchus, allows air into and out of the right lung. The other, the left mainstem bronchus, allows air into and out of the left lung. The lungs are very elastic and are made up of many tiny air sacs called alveoli. The lungs are divided into 3 separate lobes on the right and 2 lobes on the left. Even a tiny blockage of the lower airway can completely collapse a segment of the lung, making breathing much more difficult. This situation can also occur because of penetrating trauma to the lung, as in a stabbing or gunshot wound. If an opening occurs between the outside atmosphere and the lung will collapse and require emergency treatment, which will necessitate a paramedic. Alright, sorry about that mix-up with the slides there. At the bottom of the lungs is the diaphragm, a dome-shaped muscle used for breathing. The diaphragm divides the chest cavity from the abdominal cavity. The diaphragm is the primary muscle of breathing. The diaphragm works in cooperation with the external intercostal muscles, which are located between the ribs. The internal intercostal muscles and abdominal muscles may be used during forceful exhalation. As the diaphragm moves down and in, the intercostal muscles move the ribs up and out. The chest expands, increasing the volume of the chest cavity. After inhalation, tiny air sacs known as alveoli are inflated while oxygen and carbon dioxide cross their membranes. Oxygen enters the circulation while carbon dioxide enters the alveoli. Carbon dioxide is exhaled into the atmosphere as the diaphragm returns to its resting state, reducing the volume of the chest cavity and pushing air from the lungs. Just take a second right now and take some deep breaths. Take a deep inhalation. We notice the chest wall expanding, right? And what's going on? The diaphragm itself is contracting, and as we exhale that deep breath, what happens? The diaphragm expands to assist in pushing that air out. Now, it's really important to note that when difficulty breathing is present, you'll notice heavy muscle usage in the abdomen as well as the intercostal muscles. And eventually, you may get to the point where heavy muscle usage will be in the sternocleidomastoid, which is up in the neck and around the clavicles. And when you see people who are struggling that much to breathe, that they're actually using neck and shoulder muscles, then this is a definite sign of impending respiratory failure and possibly arrest. Actually, I'm sorry, that's actually a point of respiratory failure, and possible arrest is imminent. You need to rectify that situation now to prevent further issues. All right, that is all for our introduction into respirations. Thank you very much.